evening and welcome to the beginning of workshop 5, which is starting tomorrow. Today is May 10th, Monday, and tomorrow is the 11th, and that's the beginning of workshop 5. And we're getting to the end of this class, and I hope that you're enjoying the readings and assignments that you're working on, and that you're learning about information technology and how to use it as a healthcare administrator. Let me take a couple minutes to talk about the devotion in workshop 5 and then dive into the materials. This week's devotion is from the book of Numbers, chapter 13, few verses, 1 and 2, 25 to 26, and 30 to 32, and then we'll see what God is trying to tell us in this message. The scriptures read, "The Lord said to Moses, send some men to explore the land of Canaan, which I am giving to the Israelites. From each ancestral tribe, send one of its leaders. At the end of the 40 days, they returned from exploring the land. They came back to Moses and Aaron and the whole Israelite community at Kadesh in the desert of Paran. They reported to them and to the whole assembly and showed them the fruits of the land. Then Caleb silenced the people before Moses and said, we should go up and take possessions of the land, for we can certainly do it. But the men who had gone up with him said, we cannot attack those people. They are stronger than we are. And they spread among the Israelites a bad report about the land they had explored. So looking at the two different opinions in here, Caleb has one opinion and the other leaders had a different opinion. Wonder why that? They both saw the same people in whom they would be fighting against, but they had different opinion. I think we too, as healthcare leaders, we do that often. The difference here that Caleb and Joshua choose to put their trust in the Lord, in God. And they were thinking that because we have God on our side, because our intentions are good, God will be with us and God will help us and we can defeat them. But the other leaders didn't look at it this way. They looked only at their own capabilities and they didn't think that they can. We tend to do that. We tend to count on our own capabilities and abilities in the workplace, and we do not leave any room for God to help us when we need help, when our intentions are good and we're working on a project or something for the good of the people whom we are serving, which is God's people. So we need to do that. We need to learn from Caleb and Joshua and put our trust in God and remind ourselves with what Paul told us. I can do everything through Christ who strengthens me, because with him we can conquer and we can win and we can do the impossible. So that's what we need to do. Not always depend on ourselves and our own capabilities, but always look up and depend on God and bring him to the picture, at least a prayer for his to enlighten us, for him to enlighten us to what we should and should not do. And always count on his help, and you'll be amazed on what you can do with God's help. As we start workshop 5, we're going to cover two chapters, chapter 10 and chapter 11. Chapter 10 talks about the application management, administrative and financial applications. And when you look at healthcare, past and future, when I say past, I'm not talking 2-3 years, I'm talking decades, couple decades backward in the past, before the healthcare reform and before we started to take a deeper dive into electronic medical records, and before the government did the meaningful use to encourage hospitals and physicians' offices to convert from paper into electronic medical records. Back in the days, we had a computer system, we had information systems, but when you look at it was mostly financial system. Finance pretty much, and materials management to place orders and receive goods. But everything else related to clinical and patient record, that's what we used to have in a manual format. In these administrative applications that we had electronic systems for in the past, we had financial information systems, we had human resources systems, we have material management systems. I'm going to stop here because I want to group these three together: financial, materials, and HR or HRIS, human uh, resources information system. What we're doing in today's world, and that's not in the book, but I'm sure it's going to be in the next edition, these three systems, financial, materials, and HR, is now lumped into one system. And most of our organizations are implementing something called ERP, Enterprise Resource Planning. And that basically one system will cover these three aspects: financial, materials, and HR. Now, I'm going to stop, and we'll probably talk about it at some point, but it's not covered in detail in this book, but I'm sure in future books it will. And I'm sure, I have no doubt that you will hear about ERP in your organization. The other administrative systems other than these three, resource utilization system, facilities and project management system, and finally, office automation systems. In the financial systems, that's something that we all heavily rely on in today's world for our billing and reimbursement and collection and everything else. How much to bill for, how to bill, etc., etc. It's a key to what we offer for the service we offer, because if we don't make and return, we would continue our service. So we have to make some money to continue the services that we're doing. Um, financial information system usually is integrated with HR on one end, so we can pay our employees, and we can budget for their salaries, etc., etc. And also integrated with our materials management system, so we can order all of the goods we need to offer the service and pay for it and track it, etc., etc. So there's usually integration between these three systems, and that's why the new era is that new ERP or enterprise resource planning system. Um, a piece of information on HRIS. If you didn't know this, if you're not a manager who budget for your employee's salary, it's important to know that 60%, it's an average, could be a little bit above, a little bit below, but on average, 60% of each organization operating budget goes on employees' salaries and benefits. Believe it or not. That's a high number, but that's what it is. So a good HRIS or human resources information system is very important tool for the managers to plan for their staff, budget for their staff, be able to receive some sort of productivity report and do an analysis to make sure that our resources are performing the way that they should be. Um, Resource utilization and scheduling system. So information system monitors activity like inpatient occupancy rate. We know what our census are in any hospital, our clinics and emergency department activity, visualization of individual services that we offer in different departments based on the service line, and finally our patient scheduling system. Our patient scheduling system is a crucial piece, because if it's not efficient, we are missing a lot of opportunities. We need to be efficient in our scheduling system. Our scheduling system needs to be smart enough. If I call your organization to schedule a procedure and I ask for a specific day, and somebody answers the phone and say, oh, I'm sorry, that time slot or that day is busy, and it ends there, you're losing an opportunity. But if the person who answered the phone says, I'm sorry, this day is totally booked, but we have another facility that's only 4 miles away that we can help you and see you to do that procedure there. That's a good scheduling system. We're not missing opportunities. We're helping our patients and we're maximizing our scheduling and measure on that, etc., etc. Our material management system, you all know that the more that we're efficient in our materials management processes, the more that we can save money. And in today's world, in the reimbursement world that is down to the bare minimum, we have to be very cost efficient everywhere else to be able to survive on the low reimbursement that we receive. So our materials management system is another crucial piece to the formula in today's world. When we talk about office automation, communication is a key, whether it's an email, teleconferencing tool, and in today's world, it's teleconference and video conference. It gives you that almost face-to-face meeting through Teams, Microsoft Teams, or GoToMeeting, or things like that. This interactive video conferencing saved organizations a lot because it did cut on a lot of travel expenses, since it gave us as close as to face-to-face experience as possible. So we're cutting on all the travel expenses. Then, of course, the Microsoft Office and all the documents that you need to communicate and document things in our day-to-day activity. There are information systems for non-hospital healthcare organizations or divisions, things like ambulatory care information system, long-term care information system, home health information system, and also accountable care organization information system. And I'm sure in our organizations we're using a variety of these systems as well. The next thing that you will learn about in this chapter is telemedicine. Telemedicine started more than a decade ago, and it started out totally different than what we're using for today. It started out to help patients. Now, I'm going to stop for a second, go back and remind us of the triangle of care: cost, access, and quality. The telemedicine was intended to help us with that access to care piece. People who lived in rural areas did not have the right access to care, and telemedicine was designed to extend that to these rural areas. Actually, the government did have a program, a Healthcare Connect Fund, back in 2012 and 13 and 14, to help organizations extend care to rural areas, and you were paying for the internet and network connection to get to rural areas. But in today's world, especially with the pandemic, we have expanded that usage to the maximum. And we're using telemedicine in a lot of variety of things. It became a convenient thing too. For those of us who are not critically ill and don't have the time to make it to the doctor's visit, we pick up the phone and do these many forms of telemedicine to see a provider and get a quick advice, sometimes prescription if needed to. But if they see something more critical, they would advise us to go see our doctor. So the use of telemedicine has expanded in a big way. And there's a discussion at the end of that chapter. I'm sure you will read the instruction and do that. And then the last piece is chapter 11, a health information technology project portfolio management. You will learn in the beginning of that chapter that a couple of studies were made. It's been a while, maybe 10, 11 years ago now. One was done by the Standage group, and the other one by the AMIA group. They were very close in the results. They were looking at execution of HIT, Health Information Technology projects, and what is the success rate. Unfortunately, on one study, the Standage group one, 35% were successful, 65 were not. And on the AMIA one, 40% were successful and 60% were not. So 5% variance in the two studies, but pretty much they reflect the same picture. 60 to 65% of HIT projects ended up being not successful. I'm sure you're wondering why. As you read that chapter, you're going to learn all these failures were happening because of two simple reasons: ineffective planning for these projects or ineffective execution. And ineffective execution is the number one cause for project failures. Going to last week and the 11 steps that we need to do when we're managing an HIT project, with step number one, identifying the scope. What problem are we trying to solve by implementing this system, and going through the whole sequence to step number 11, benefits realization. I'm going to assess that I achieve what I was hoping to achieve from that system or not. So why am I talking about that before we get into the PMO office? Because the PMO will help us flip the chart and make it not 65-35 or 60-40, but almost 95 or even higher success rate, and the rest would be the unsuccessful one. And the unsuccessful one will be the one that we did not follow the 11 steps in the right fashion and giving every step its attention. Project Management Office or Project Portfolio Office, what that office do? We all have tons of projects in our organizations, sometimes small, sometimes large. So that's a project. It means someone to manage to be successful. Since sometimes you have multiple projects related to the same initiative. For example, my organization putting a new building, offering a new service, cancer center, whatever the case might be. And that is going to be multiple projects. Somebody managing the building, somebody managing the infrastructure, somebody managing the applications, the hardwares, etc., etc. So those will be multiple projects related to the same big project. In that case, we'll call it, that's a program management, managing multiple projects, but they are all related. And then at the end of the day, the PMO is managing projects and programs and everything in between. When you lump all these activities together, that's a portfolio management. So in my portfolio, I might have 5 programs and 200 projects, and those 200, some small, some medium, some large, etc., etc. That's what the function of the project management office is. So a portfolio management office is centralized organization dedicated to improving the practice and outcomes of projects via a holistic management of all projects. So definitely when one eye is focused on the whole picture for the organization, and when I say one eye, I don't mean one individual, but one department, the portfolio management office, then you will see the big picture and you'll be able to put some improvement to the processes and make the process as efficient as possible. You have the PMO is really essential to our organization because you have a variety of things. You have clinical applications going on. You have business applications going on. You have infrastructure needs and projects going on. And the PMO will put all this together under one umbrella and be able to manage it in an efficient way. You're going to learn in Exhibit 11.3 in this chapter about an organization that implemented a pharmacy system and going to the best of breed, but we didn't follow the proper project management office recommendation. So we ended up with a system that is not integrating with the hospital information system. That's a big problem. When we don't follow the process, we run into issues like that. And after spending the money, it's too late to back out. And in that case, it becomes just a loss. There are a few key functions of the project management. They help us with project initiation, project planning, number one cause for failure, project execution, second main cause for failure, project monitoring and controlling, in other words, someone keeping an eye on the project, making sure that I'm sticking to all the 11 steps and providing status report weekly or bi-weekly as we go until completion. And finally, project closing when I meet all the requirements and achieve what I'm trying to achieve for that project. There are too many tools out there that help us or help the project managers to manage projects. Microsoft have a project management tool, that's one. There's one called Clarity. It's made by Computer Associates. There's one called ChangePoint, made by CompuWare and the Microsoft project I mentioned. There is also one made by Oracle, Primavera P6, and there's too many different tools for project management. ServiceNow, which is one of our main systems used as an ITIL tool in our organization that help us implement that framework, is also offering a project management tool within that bigger system. The project management knowledge areas have few things that we need to be familiar with: project integration management, project scope management, project time management, project cost management, project quality management, project HR, human resources management, and project communication management. In larger projects, they hire a person just to do the communication for this project. When it's something large and it's costing $1 million, multi-million dollars, usually hire one person for the communication. And also there's project risk management and project procurement management. Usually the project manager for that project will manage all these aspects. Unless if it's really big, then he would have helpers to manage that project. The project portfolio management office usually have a dashboard where you can see picture at a glance. What do we have? What's red? What's green? How many programs we have? How many projects we have? With a click of a mouse, what are the projects that are in green state? What are the projects that are in yellow state? Maybe need to get some intervention from leadership to get it back on track. And what projects are in red state? They definitely need some attention and need to bring the project sponsor to help take it out of the red. When we talk about the project portfolio management office, there are 4 stages depending on the maturity. So it's either we have an organization that is still at an ad hoc stage. There's no formal project management capability. That's an ad hoc stage. An organization that have a project management office that already is doing creating requests and centralizing the requests for a project, that we call that a defined stage. When you have an organization that have that defined stage, but also they manage a portfolio, then that's an organization that's at a managed stage. And finally, if you have an organization that have a managed portfolio and they also have a scorecard for each project and a dashboard that they manage the big picture, that's an organization at the top level, which is the synchronized stage or level 4. I hope that your reading materials will be interesting to you and will help you in the final project that you're going to be working on next week in workshop 6. As usual, if you have any questions, feel free to call or email tomorrow night, Tuesday. I'll have the office hour from 7 to 7:30 and open discussion for those who wish to do the discussions live with me from 7:30 to 8:40 p.m. Thank you. Have a great day and have a wonderful rest of the week.